Our Right Honourable Prime Minister, as said before, please kindly take your seats so we can get started in the next 5 minutes. Thank you.
Got it. Yes. Who is this? Hey, how are you, Yohatani? Welcome. It seems like the trend every time, you know. Oh, I'm so sad to miss you. Welcome to Kigali. Well, we have to coordinate better. Thank you, Nikonjo.
Ladies and gentlemen, please help me welcome, if you don't mind rising to your feet, for our guest of honor, who will be here any minute now. Any minute. But a warm welcome to our other dignitaries who are filling in their seats in the meantime. It's good to have you here. Thank you all for joining us. Thank you, thank you. Wow, when the lights come on, I know the show's really about to start. Ladies and gentlemen, our guest of honor today, the Right Honorable Prime Minister of the Republic of Rwanda, Honorable Edouard Girende. You may all take your seats. The Right Honorable Prime Minister of the Republic of Rwanda, Honorable Edouard Girende. All honorable ministers here present, all dignified guests, all protocol observed. A warm welcome to you to the second International Conference on Public Health in Africa in Rwanda. I am Ruveneko. I am going to be your Director of Ceremonies for this opening event, and I'm delighted to be back here. It's always good to be back in Kigali. Welcome, bienvenue, murakazi i Rwanda. Now, this is the second conference that has been held by the international, so it's the second International Conference on Public Health in Africa. And I'm happy to be here today to witness the conversations that are going to be happening. Over the next couple of days, there are going to be a number of dialogues going on. And this conference is not just brought to you by what we're calling, I guess, CFIA. You can hyphenate it however you want. But really, it is a combination of the African Union and the Africa Center for Disease Control and Prevention's public health. And it's also hosted this year by the Rwanda Ministry of Health and the Rwanda Biomedical Center. So this is a combination of efforts coming together to make sure that we receive the best healthcare that Africa can develop, right? And the best healthcare that Africa can give. When I was flying here, and I was on the flight yesterday, I had the pleasure of sitting next to one of the speakers today, and he's going to be on, I think, the next panel. And we were talking, and you know how it is on the airplane, you're not sure whether to start conversation or not, right? Because sometimes someone can talk your ear off for 2 hours, and I just want to take a nap, you know? But he was very, very polite, and we had a very good conversation. And sadly, or proudly, he's from England, and they're out of the World Cup. So I then got stuck on that point, like, what am I supposed to say, you know? But to all of us as Africans, are we behind Morocco? So just to remind us all while we're here, a line I learned today. Ubuzima bwawe, nibo butunzi bwawe. So over the next 3 days, you'll hear from scientific leaders and public health experts from across the continent, and they'll reflect some of the most urgent health and development challenges facing Africa today. We're also excited to use this conference as an opportunity to engage the next generation. So with over 65%, in some countries over 75% of the youth representing Africa, it was good that the beginning of this conference was preceded by 2 days where the youth there was a youth pre-conference where they got to come together and exchange their ideas. So it's always good to hear youth involvement at platforms like this, especially on such a high level. So thank you for having us. So together we'll look at how we can build stronger systems and more resilient systems that are capable of making progress on long-standing challenges that we've been facing, like HIV, TB, malaria, and of course other emerging issues like non-communicable diseases. So it's exciting to be part of this, as I said, and to hear the conversations that are going to happen. The day, tomorrow, even Thursday is going to be full of content, and it is definitely something that you're going to walk away from this conference enriched and hopefully having exchanged your intellectual ideas to better our continent. So, and to strengthen African leadership in health, we need to elevate African science. Together, we invite you to explore how we can realize a new public health order in Africa and to build the Africa we want. Now, if you could turn your attention to the screens for our welcome video. Thank you.
Murakazaneza, bienvenue, marhaba, benvindo, karibuni. Welcome to the second International Conference on Public Health in Africa, CPHIA 2022, hosted in Kigali, Rwanda. Africa reports the heaviest burden of public health emergencies in the world, with more than 100 such events occurring every year. COVID-19 has revealed the gaps in the continent's public health emergency preparedness and response systems and threatened hard-won gains against infectious diseases. The recent outbreak of the rarer Sudan Ebola virus strain in Uganda reminds us that we are all still vulnerable. In addition, non-communicable diseases like cancer, diabetes, and heart disease, the burden of mental health issues, and the effects of climate change threaten the livelihoods and health of millions of people. Yet, the past 3 years have also highlighted the incredible ingenuity of Africa's scientists, health workers, and public health leaders. At this critical inflection point for the continent and the world, CPHIA 2022 will serve as a platform to leverage our African potential. Over 3 days, we invite you to connect and explore ways we can collectively contribute to achieving a new public health order in Africa. Together, let's take this opportunity to build stronger, more agile, and resilient health systems. On behalf of the African Union, Africa Centers for Disease Control and Prevention, our host, Rwanda's Ministry of Health, and the Rwanda Biomedical Center, and the co-chairs of CPHIA 2022, thank you for joining us.
Our first speaker today, if you could please help me welcome, and I'm very excited to introduce, the Honorable Dr. Ivan Butera, Minister of State at the Rwandan Ministry of Health. Dr. Butera previously served as Director General of the University Teaching Hospital of Butare and the Rwanda Biomedical Center. No one more fitting to introduce us today and welcome us as we hear from him and as he sets the stage as well for the next 3 days. Please help me welcome Dr. Ivan Butera.
Right Honorable Prime Minister of the Republic of Rwanda, Honorable Ministers, Director of African Center for Disease Control, co-chairs of the CPHIA, Professor Senait, Professor Binagwao, Excellencies, distinguished guests, dear delegates. Good morning, Ngaramutse. Welcome to the second International Conference on Public Health in Africa. Allow me to begin by extending a special vote of thanks to Africa CDC, co-chairs of CPHIA, and the leadership of the government of Rwanda in advancing the Africa 2063 agenda, the Africa we want. The government of Rwanda, through the Ministry of Health, is happy to collaborate with Africa CDC towards implementation of the new public health order in varied aspects, including strengthening institutions for public health, building our public health workforce, expanding local manufacturing, increasing domestic investment in health, and promoting strategic partnerships, which resonates very well with the theme of the conference, preparedness for future pandemics and post-pandemic recovery, Africa at Crossroads. We are pleased with the pertinent discussions that took place during our side events that kicked off yesterday, and we look forward to joint exchanges on Africa becoming a knowledge-based powerhouse with regards to providing solutions to meet our population health needs, building the health system towards achieving the Sustainable Development Goals, as well as adequately and timely responding to outbreaks. The conference is also an opportunity to showcase the work done in different parts of the continent and the world to promote the health and well-being of our population. I wish you all a fruitful and enlightening discussions throughout the duration of this conference. And I encourage you to make connections, ask difficult questions, share best practices, and inspire new validated standards of practices. With this, allow me to conclude my remarks, and thank you very much for your kind attention.
Thank you very much, Dr. Butera. Now we are going to get our next speaker to come on the stage, Dr. Ahmed Ogwell Oma. Please help me welcome him to the stage.
Thank you, MC. Good morning to everyone. Your Excellency, the Right Honorable Edward Ngirente, the Prime Minister of the Republic of Rwanda, Your Excellencies, Honorable Ministers here present, Your Excellency, Commissioner Minata Samate from the Africa Union Commission, the heads of the various institutions, heads of delegations, participants and delegates, ladies and gentlemen. Today is a day that is full of joy for me, a day that is full of joy for the Africa CDC. It is indeed a pleasure for us to welcome you to this second edition of the International Conference on Public Health in Africa, the first in-person edition of this conference. I say this with confidence that this is the premier conference on public health in Africa, so you today are in the right place at the right time, and I thank you for being part of this conference this week. I'm deeply grateful to the government of Rwanda for hosting this in-person event this year, and Excellency Right Honorable Prime Minister, please do take back our gratitude and our warmest greetings to His Excellency President Paul Kagame and the whole government, the entire country, for the warm hospitality that you have shown us and continue to show us. We shall be back soon. I pay tribute to the co-chairs of the conference who have coordinated a fantastic team that has made this conference possible in person this year. I promise you, this was the African spirit of resilience while delivering top quality. So thank you, my very dear sisters Agnes and Senite. And thank you to the Secretariat led by Shingai. The team has worked smart, they have worked hard, and they have handled very many complex issues with patience and professionalism. So I say thank you to the Secretariat. Your Excellencies, ladies and gentlemen, this conference is a platform where African and international experts have come together to find solutions for the public health challenges that we face here in Africa and by extension, globally. This is also the platform where you as experts are going to guide implementation of the solutions that we need to make a real and lasting change to health security globally. This is a conference put together by Africans, but it is for everyone. We welcome all our friends and partners from around the globe to join us as we set our agenda and priorities for the continent. Africa CDC, as an autonomous health institution of the African Union, is a key agency in delivering Africa's vision of Agenda 2063, the Africa we want. In this regard, I would like to take this opportunity to thank the Africa Union Commission for its unwavering support of Africa CDC. And therefore, I would like to request Commissioner Minata to take back our greetings and our gratitude to His Excellency Musa Faki Mohammed and the entire Africa Union Commission. Africa CDC is about 6 years old since it was officially launched on the 31st of January of 2017. In these few years, we have managed complex health emergencies on the continent. We have addressed numerous disease threats and gained valuable experience and lessons in the process. We have become quite good at harnessing the expertise on the continent, our local resources, as we respond to some of the most challenging disease threats on the continent, indeed, some of the most challenging that the world has ever known. We have decided that we will turn these lessons and experiences into opportunities. Opportunities to grow our capacity for prevention and control, indeed, for response to diseases. Opportunities to grow our capacity, our health systems on the continent. Opportunities to expand the involvement of our young people in our work of safeguarding Africa's health. And I'm very pleased to see the early results of some of the actions that we have taken to address these opportunities. One such early result is the involvement of the youth. We had a very successful and rewarding youth pre-conference on the 10th and 11th of December here in Kigali. In fact, I am so pleased with the excellent engagement of our youth that I have decided to establish a youth advisory team for Africa CDC. This team of youth will advise the Director General of Africa CDC on the most effective ways that we can harness the energy and the passion of our youth so that they can be fully involved in the prevention and control of diseases here in Africa. We hope that we are going to persuade most of them to remain on the continent. I will be announcing the inaugural Youth Advisory Team at the closing of this conference. So you, our youth, are not just the leaders of tomorrow, you are our present, and you are our future. Your Excellency, the Right Honorable Prime Minister, Your Excellencies, Honorable Ministers and Heads of Delegations, ladies and gentlemen, and our youth, one significant lesson that we have learned is that it is time for Africa to take ownership and responsibility in shaping our present and our future. We recognize the crucial importance of creating a space where ideas and insights are shared amongst the brightest African and international minds. A space where innovation can flow freely, a space where these ideas are turned into concrete solutions for the problems that our continent face. A space where we welcome ideas from all over the world because we have chosen not to do this work alone. This conference is that space. So I urge all of you to participate fully. Please arrive at this conference full of ideas. Offload them, all of them, here at the conference, and please go back empty of ideas so that you are ready to fill your mind with even more ideas in time for the next conference. Every idea that you have actually does count. Allow me to also persuade you that it is time for a new way of doing things on the continent so that we can be able to achieve our health security agenda. Our vision of that different way of doing things is the new public health order. A vision that takes Africa from always following others, that is to an Africa that is confident in its own scheme. A continent that sets its own agenda, develops its own internal capacity, establishes its own priorities, seeks indigenous solutions and uses domestic resources to initiate action. A continent that is ready to partner based on African priorities. This is Africa's new public health order that is currently being actively implemented by the Africa CDC, the African Union, and our partners. I therefore call upon all our member states, our partners, civil society, the private sector, the youth, the public in general to join us in expanding implementation of this vision. Your Excellencies, ladies and gentlemen, and our frontline workers. The theme for this year is very timely. It speaks of an Africa at a crossroads. Crossroads on how to prepare for future pandemics and disease threats. Being at this crossroads doesn't mean that we are lost. In fact, we know exactly where we want to go. At this point, we are now deciding how efficiently can we reach that point that we want to go. As Africans, we've not been very good at blowing our own trumpets. As public health professionals, we are so focused on delivering the work that we are assigned to do that we don't pause to tell our own story. This must change at this crossroad. So let me tell you a story. In just 6 months between February and August of 2020, Africa CDC, with support from our partners, we moved the continent from only 2 laboratories that could test for COVID-19 to every country on the continent being able to do the same from hundreds of laboratories, all done within 6 months and during lockdowns. We went ahead and built a network of laboratories that can do sequencing, first for COVID-19, the virus that causes COVID-19, and progressively any pathogen that we would have wanted to sequence. Right Honorable Prime Minister, all this was done during lockdown and at a time when it was very difficult to access equipment, difficult to access reagents, difficult to access test kits. This is an African success that is unprecedented. We are proud of it. It is a story that I hope we will continue to tell, not just here at this conference, but even outside when we engage with the rest of the world. During the pandemic, we built the capacity of African professionals in all aspects of pandemic preparedness and response. We used webinars to reach every corner of the continent. And where possible, we deployed our rapid responders, even using special transport, because there was no regular transport to be able to go from one country to the other at that time. These workers, these frontline workers, did a fantastic job, and they continue to do a fantastic job despite the many challenges that they face when they are out there in the field, whether the outbreak is Ebola, it is COVID, it is cholera, polio, measles, whichever outbreak it is, our health workers do a fantastic job. To our frontline health workers, we salute you, and we are proud of what you're doing for this continent. We are so proud, Your Excellencies, that as Africa CDC, we have decided to establish the Africa CDC DRASA Award for Frontline Health Workers. We shall be officially launching this award here today in the next session. This is another very good African story. But I think I'm done with stories, Your Excellencies. And as I conclude, Africa needs each one of us to make a concrete contribution, and nothing is too small. Contributions from the younger and the older ones, the female and the male, the citizen and the visitor. We each have a unique role to play in continuing to safeguard Africa's health. We must, however, believe first in ourselves, believe that we can strengthen our health institutions, believe that we can build our health workforce, believe that we can manufacture health products here on the continent of Africa, believe that we can mobilize more domestic resources to address our priorities, believe that we can build lasting partnerships. We can, as soon as we believe, then we truly can. Let us all stand on the shoulders of our giants as we navigate this crossroads. The shoulders of our departed visionary leaders like Kwame Nkrumah, Haile Selassie, Jomo Kenyatta, Mwalimu Julius Nyerere, Kenneth Kaunda, Thomas Sankara, Nelson Mandela, and others. The shoulders of our present visionary leaders who guided this continent through the pandemic like Paul Kagame, Matamela Cyril Ramaphosa, Musa Faki Muhammad, and others. The shoulders of our professionals like John Nkengasong, the first director of Africa CDC, the shoulders of our co-chairs, my dear sisters Senait and Agnes, the shoulders of our frontline workers like the late Dr. Ameo Stella Adadevo. Let us stand on your shoulders. I know that mine are ready to be a stepping stone for others to do even bigger, bolder, and greater things for Mama Africa. Our African icon Nelson Mandela said, "It seems impossible until it is done." And let me persuade you that Your Excellencies, dear colleagues, that implementing Africa's new public health order is possible. So let us go out and do exactly that. I wish us all a very rewarding deliberations, lasting professional and personal networks, and may you all feel the weight of responsibility to make the new public health order a successful reality for this continent of Africa. I thank you. Asante sana, merci, muito obrigado, shukran, gracias, murakoze.
Thank you very much, Dr. Oma. I think we are all inspired by that speech. Lots of work to be done. And I am happy to hear you talk about us developing our own solutions to our own problems. We talk about this all the time. And you talked about ideas infinitely. And I read that ideas not coupled with action never become bigger than the brain cells that they occupy. So I hope that with all your brain power, that all your ideas get turned into action and that they yield fruitful results. Now, we have had many milestones, as you mentioned, in Africa, and many diseases that we fought with limited resources. So allow me, who has nothing to do with the health sector, understands very little about medicine and the fight that doctors have had to go through, especially through this COVID pandemic, to just ask for a round of applause for all those workers who have done an amazing job with the resources and the limitations. So again, with the little understanding I have, I guess there are three things, right? Number one, prevention. Number two, prevention. Number three, prevention. Please help me welcome now one of Rwanda's pride and joys who are going to give us some entertainment. They're going to take over the stage. That's why I'm standing down here. Please help me welcome the Rwandan National Ballet, Uru Kerereza.
Turagukunda we,
Thank you to Uru Kerereza. And now we are going to have our next speaker, Dr. Tedros Adhanom Ghebreyesus. And he's going to give this presentation virtually, so please, if you could draw your attention to the screens. He's the Director General of the World Health Organization.
Excellencies, dear colleagues and friends, the COVID-19 pandemic demonstrated that our health systems are not resilient enough to withstand a major crisis. As always, the most vulnerable and marginalized communities were the most affected. Building on the lessons of the pandemic, WHO has made 10 key proposals for a stronger architecture for health emergency preparedness and response, including stronger governance, stronger financing, stronger systems and tools, and a stronger WHO. Several parts of that architecture are already being constructed, such as the International Accord on Pandemic Preparedness, the Pandemic Fund, the WHO Hub for Pandemic and Epidemic Intelligence, and the strengthened Health Emergency Corps. And last year, WHO helped establish the mRNA Technology Transfer Hub in South Africa to give low and lower middle-income countries the know-how to rapidly produce their own vaccines. Earlier this year, I was delighted to be in Rwanda for the groundbreaking of a new manufacturing facility in Kigali. Preparedness depends on collaboration, which is why WHO is working closely with the Africa CDC to strengthen our continent's defenses against outbreaks, epidemics, and pandemics. As our continent recovers, it's also essential that all countries invest in strengthening their health systems, especially primary health care, on their journey towards universal health coverage. That is the best investment in a healthier, safer, fairer Africa. I thank you.
Thank you to Dr. Tedros. It is now my pleasure to introduce Professor Senait Fiseya, Co-Chair of CPHIA 2022 and Vice President of Global Programs at the Susan Thompson Buffett Foundation. Professor Fiseya is a recognized leader in expanding access to reproductive health services, advocating for women's health and reproductive rights around the world. Let's hear live virtually from Dr. Fiseya.
Thank you, MC. Your Excellency, Honorable Prime Minister Edward Durante, Prime Minister of the Republic of Rwanda, Your Excellency, Ambassador Aminata Samate, the Commissioner of Health, Human and Social Affairs at the African Union, Honorable Ministers, Honorable Acting Director of Africa CDC, my brother Dr. Ahmed, distinguished guests, representatives of government, academic institutions, CSO, development partners, Africa's researchers and public health experts, and all participants committed to advancing public health in Africa and the world. All protocols observed. Good morning, Mwaramutse. It is my immense pleasure to join you this morning for the opening of the second conference on public health in Africa. I sincerely wish I could have been there with you in person to welcome you to beautiful Kigali, my chosen home and Africa's rising star. I'm grateful for technology that made our first ever CPHIA possible, with over 12,000 participants joining from all over the world, and today allows me and many other speakers to join virtually so that I can say the warmest welcome to all of you. Murakaza neza, as we say in Rwanda. Welcome to the second conference on public health in Africa, and the first one taking place in person, as you've heard from previous speaker. This is the meeting that we know will be the forum to shape and implement the new public health order for Africa. I would like to begin by acknowledging the organizing teams behind this and the leadership of African Union and African CDC in particular. This would not have been possible without your leadership and relentless efforts to make it a success. I also would like to acknowledge Dr. John Nkengasong. It was whose vision to create a new public health order and CPHIA, especially at the foothill of what we experienced with the COVID pandemic. So I want to stop and give a shout out to the Africa CDC and AU team. Please put your hands together to all who spent sleepless nights to make CPHIA 2022 a reality. To the government of Rwanda, and specifically the team at the Ministry of Health and RBC, and the former Minister of Health of Rwanda, Dr. Daniel Ngamije, thank you so much for your deep commitment to advance public health in Africa and ensuring the success of CPHIA 2022. You're excellent hosts, and we're grateful for your exceptional hospitality. This is what it looks like when we come together with commitment and excellence to build the platforms and institutions that we wish existed. This is what it looks like when we construct space for our continental priorities and talent. Platforms like CPHIA not only elevate the new African public health order, but also add critical value to the broader global health discourse and practice. And for those who know me, I think I will be not true to myself if I don't call out those inequalities. I really want to take a minute to emphasize that when the most marginalized, be it groups of people, countries, or regions rise, the whole world rises. Even if it was not the case, though, we should still strive to ensure that the most marginalized are protected and served. But it is an undeniable reality that when we expand the center or shift access to resource and power, then we fundamentally elevate life and systems for everyone. I will not say much on what it is like for those on the margins when exclusion and discrimination are rules of the day, because that is the snapshot of our current unjust reality. But I will mention that the inequities in global health were magnified at the height of the COVID-19 pandemic, with problematic exclusionary practices, unsurprising failure of systems, and even marked differences in compassion. We learned once more that the world would deprioritize our continent and its needs instead of finding ways to work together to optimize resources and find creative solutions to our shared challenges. When dealing with established system of any kind, the familiar adage is that you should never take no for an answer and instead bring your own chair when denied a seat. The lessons of the pandemic thankfully led to our unbreakable resolve to strengthen our institutions and go beyond bringing our own seat. We now vow to make sure that no African, or anyone for that matter, has to ever fight to find space for the folding chair in existing global health rooms and proverbial tables. While this idea of adding seats here and there or reminding gatekeepers to ensure diversity and so on is important as a short-term solution, it will not lead to fundamental and lasting shifts in inclusion and justice. The current discourse, for those paying attention, simply affirms the very urgent need to recalibrate the terms of engagement within global health. That is how we will truly address the root causes of this power imbalance in access to resources and leadership. So CPHIA is our collective opportunity, not just for Africans, but for everyone in the room, to set precedent on how to pour into and elevate our institutions and platforms. This is where we can set strategic objectives and a global agenda with the aim of building resilient health systems, local manufacturing capabilities, strong institutions, and a skilled workforce to truly transform lives. At this momentous occasion for our continent, let me leave you with a few reflections. First, it's important to note that the age of setting Global South health agenda and the Global North-based headquarters is coming to an end. This approach, as I'm sure many of you will agree, is not only ineffective, but also unsustainable. We ought to genuinely shift power or accept that we are contributing to perpetuating the problem. Africa has the human capital, untapped resources, and a renewed appetite for transformative work. We saw this in the Africa's COVID response despite limited resources. So it's time for mutually beneficial and dignified partnerships because, as shown during the pandemic, Africa has many life-saving lessons and guidance to share with the rest of the world. Secondly, CPHIA is no longer just a conference. It is now a movement. CPHIA is a manifestation of the best of our continent and a movement to propel Africa's new public health order forward. Therefore, we need to continue building more and more institutions and platforms that will prioritize, engage, and honor our scientists and researchers, clinicians, and policymakers. We need to focus on fostering innovation, data analytics, research capacity strengthening, and above all else, ensuring that women and girls are central to our health system conversation and not an afterthought, as it often happens. Finally, to the young people in the audience, you are witnessing the foundational discussions about systems and institutions that you will eventually lead and sustain. Rise to the opportunities and know that we all are working to give you a continent a bit better than we found it, so that you are able to transform it in all the ways we have not. Looking at this gathering and the details of this program, I'm genuinely in awe of what we have been able to achieve in just 2 short years. This makes me deeply optimistic for what is to come and more certain that we will change our continent for the better. The lineup of speakers, side events, research presentations are so impressive. I have no doubt each discussion will be rich and inspiring. I wish you all a very productive and exciting time in Kigali, Murakoze Chane, and thank you so very much.
A big thank you to Professor Senait for that delivery. Now, I've been told as a woman, as a young person who represents the youth, that if you can't be offered a seat at the table, make your own table. But Professor Senait enlightened me now, because sometimes you have to sit at certain tables, so bring your own chair. I liked that. So to the young people in the room, and sometimes marginalized women, please know that it's not always about bringing your own table. I mean, sometimes I think I am the table, but it's nice to it's nice to be reminded that sometimes on the chairs and tables you have to fit, bring your own chair. So yeah, in terms of engagement, I like that she touched on that as well, and having mutually beneficial partnerships for our continent. I'm personally tired of being so rich as a continent, yet still so poor. So I hope we can transform that. And to you as CPHIA, we look forward to watching the movement. In my other life, I'm a journalist, and these are the stories we like to tell. You know, you talked about storytelling, and it is good to continue to be able to tell a good story of Africa. So I do look forward to reporting and writing about the CPHI story, and that I was a part of it in year 2, and hopefully more to come, but we do hope that the movement grows stronger. So please help me now welcome our next speaker back on the stage. It is my honor to introduce Professor Anes Binagwaho, CPHI 22. No, sorry. Yes, you're okay? CPHI 22 co-chair and retired vice chancellor of the University of Global Health Equity. We love your energy already. Thank you.
Hello, everybody. Oh. I just hear that Africa is full of energy. Hello, everybody. Ah, I feel better. So, I am humbled and honored to join this distinguished speaker to welcome you today to the 2nd International Conference on Public Health in Africa 2022. Honorable Right Prime Minister, Honorable Minister of Health, Director of CDC Africa, all excellencies here present, I'm really delighted to be with you all. I am indeed filled of joys to welcome you, and in compliment of my sister and co-chair, Senait. Allow me to also take this opportunity to thank the government of Rwanda for all the efforts made to make this convening a success. Thank you, Honorable Right Prime Minister. I'm also very grateful for the exceptional leadership of the African Union and the Africa Center of Disease Control and Prevention for all what they did to create and to make this convening an important event. Thank you. Along with my colleagues, we have worked hard to deliver this event to Africa, to the world, and to contribute to work towards the Africa we want. Excellencies, ladies and gentlemen, in my career, I was fortunate to serve in different capacities that exposed me to different perspectives. This path has made clear that if we want to tackle health matters efficiently, we must adopt a multi-sectorial approach that brings together all the needed expertise. In the current world context, Africa is at the crossroads. While we face great challenges, we also have exciting possibilities ahead of us. As we continue leading in our continent all together, it is our time as Africans to invest smartly, bring our own expertise at the front, and strengthen our institutions and workforce. Along this line, CPHIA aims to contribute to this transformative journey of Africa, and this is why, with the support of the government of Rwanda, the support of CDC Africa and African Union, we have bring all of you here together to think and to reflect on how to improve the public health in our continent, but also how to take stock about what we do. Because in Africa, so many good things happen, but we used to go and explain them in Europe, in America, and elsewhere. So let's come together as Africans and discuss them among ourselves, with the pleasure to have here all our partners. Building on the first edition of CPHIA, which I also, with my sister Senate, had the pleasure to co-chair, this conference will provide a forum to shape more resilient health systems that can effectively respond to future crises. Our vision is also that this platform contributes to building an enabling environment in Africa characterized by strong political will, and your presence here, Honorable Right Prime Minister, is really expressing that, so that we continue our journey to a self-sufficient Africa that is able to deliver the necessary health services with quality, and also continue the journey to manufacture the life-saving commodities needed for our population to have better health outcomes. We are eager to see up and coming future leaders take ownership of Africa's health landscape and foster data-driven decision-making based on science, and make those decisions lead Africa to a sustainable development. Excellencies, ladies and gentlemen, thank you for being here today with us, and welcome to CPHIA 2022. Thank you.
Thank you very much, Dr. Binagwaho. Now we are going to hear from the monitors, if you could direct your attention to the screens. And as we've seen over the past 3 years, COVID-19 has overstretched our health systems and forced us to redistribute health workers, financing, and resources. Let's take a few minutes to delve into how African countries are working to overcome these challenges. Here is the health systems video.
COVID-19 had a big effect on most of our diseases on the continent. The health facilities, they were now taken over. And because of that, we didn't vaccinate against other vaccine-preventable diseases.
You could see the indicators dropping in some of the areas that should have been doing much better.
We have seen how the COVID-19 pandemic has also affected diseases like HIV, like TB, like malaria.
Africans are fighting epidemics every day. So how do we share lessons learned? How do we pick best practices? But how do we also collectively set a continental agenda?
This pandemic has taught us many lessons, and we have decided to use those lessons and turn them into opportunities to address other disease threats and health emergencies, to be linked directly to Africa CDC's new public health order. We are using the human capacity that has been strengthened during the time of the pandemic. We are using the infrastructure that has been developed for early warning systems, for disease surveillance, and also for response. The lessons that have been learned are strengthening the whole health system.
When the Ministry of Health in Uganda declared the Ebola outbreak, the Africa CDC immediately also activated its systems. They deployed a team to Uganda to support the ministry.
One important lesson that we want to really emphasize here is the ownership and the leadership of the government.
If you look at the way the government of Uganda responded to this outbreak, it's really amazing. They activated all their different systems from the national level up to the village level.
Leadership is all about governance and coordination, but you also see how leadership connects to the community and to implement decisions for the community with their involvement.
During the Ebola pandemic, Ghana prepared very well for it. What saved us was the preparedness that we put in place for COVID-19. The president actually took charge, formed a committee. So if something needed to be done, everybody was sitting at the table.
If there's one thing we need to do, it is to invest in our African researchers who will look at African problems and give them African solutions. And those solutions are then going to be turned into concrete products that address health challenges.
We need to train our people to be able to provide these tools, to manufacture these tools within our systems.
We were shocked at the level of innovation that Ghanaians had when it came to producing stuff for COVID-19. We were producing personal protective equipment, nose masks, sanitizers, hand washing equipment.
When a next pandemic comes, the continent is better prepared. We are able to have infrastructures and facilities and workforce manpower to manufacture personal protective equipment, laboratory diagnostic equipment, local vaccines.
We must build infrastructure for human vaccine manufacturing. And here, it requires working together with the private sector.
This facility will work closely with a plant in Ghana to ensure a complete end-to-end production chain in Africa.
One country cannot do it alone. One institution like Africa CDC cannot do it alone. You have to work with partners, co-creating solutions.
We have a lot of work to do to move forward in the fight against not only malaria, HIV, TB, but even against non-communicable diseases that are growing up on our continent today.
The best way to fight any pandemic or to control any pandemic is to have very, very strong health systems.
Africa had shown leadership. Africa has innovated through its constraints and limitations, and I think has a lot of lessons to offer to the rest of the world as well.
Now, I hear a lot of emphasis on systems, right, and strong healthcare systems to combat much of these problems. But I just want to highlight something as a young person to all of you today, that some of the conversations I have with other young people that are very scary highlight that as much infrastructure as you might put in place, we also have a mindset shift that we need to work with. And I'll speak particularly about HIV and AIDS. See, I'm from a generation that witnessed an HIV and AIDS in my country from the 90s and early 2000s, where people died, where we've got family members who we know and we remember, and we watch them deteriorate, and we saw what HIV can do. And now this generation coming up, right, the Gen Zs, the millennials, you'll ask them, whether you go to university campuses or high schools and speak to them, and you'll say, well, when it comes to, your sexual behavior, what are you most afraid of? And most of them will say, oh, I definitely don't want to get pregnant, while they're not really afraid of HIV and AIDS because they haven't seen it the way that some of us have seen it. So you find that some of these things need a lot more education. Not that we've forgotten about education on HIV and AIDS, but it's a different kind of education. It doesn't scare them as much anymore. One of them even said, I'd rather have cancer, because in their minds, you can live longer with HIV. So they said, they said you can live longer with HIV than with cancer. So there is a mindset shift that needs to happen. So I hope you remember these things in these conversations, and I can't emphasize enough how good it is to have the young people in the room to represent those challenges and let you know what you're dealing with when you put all your systems in place. And with that, it is now my honor to welcome onto the stage our guest of honor today, the Right Honorable Edouard Girente. He is going to come up and he's going to speak to us. Hopefully this is your home, sir, but hopefully that we'll get to draw from you and your wisdom. Please help me welcome the Right Honorable Prime Minister of the Republic of Rwanda, Dr. Edouard Girente. Thank you.
Senior government officials here present, honorable ministers, acting director of African Center for Disease Control and Prevention, co-chairs of this conference, distinguished guests, and delegates here present. Good morning and welcome to Kigali. I am pleased to join you today for the opening of the second International Public Health Conference in Africa. I would like to start by congratulating the organizers of this important conference, which is a unique platform that helps to discuss challenges and build better, resilient health systems on the continent. Thank you for your dedication and tireless effort to make this event happen. While we have made progress in safeguarding public health, more needs to be done. Allow me to highlight three important aspects. First, public health is about capacities of countries to take appropriate actions to protect and care for the health of citizens. As such, resilient public health practice must have systems able to detect and respond effectively to outbreaks. The COVID-19 pandemic exposed gaps in global health systems, including inadequate emergency preparedness, access to vaccine and technologies, and insufficient well-trained personnel. This stressed the need to prioritize and invest more in national health programs. Second, there is a need to put in place health systems that not only ensure universal access to essential health services, but that also provide quality health services. Therefore, it's important to keep in mind the positive correlation between the health of our citizens and economic growth. To build a better future for our continent requires establishing strong and resilient health systems across the continent. Third, as we pursue recovery, it is high time Africa leverage existing opportunities in the effort to building resilient systems. In Rwanda, for example, with the disruption of the global supply chains due to COVID-19, the pandemic revealed unseen opportunities. We realized that many of the products we imported, such as personal protective equipment, could actually be made in Rwanda by repurposing existing manufacturing facilities toward COVID-19 related products. This clearly demonstrated the huge untapped opportunity in our domestic manufacturing. Tapping opportunities also requires enabling a conducive research and development environment. I invite investors and innovators to build on the new evidence-based solutions that I am certain will be shared during this conference. Rwanda is committed to contributing and supporting advancement of innovative public health initiatives across the continent. Thank you again. Thank you for your kind attention, and I wish you a productive conference and a pleasant stay in Kigali. Thank you.
Thank you very much to you, the Right Honourable Prime Minister. Appreciate your remarks, brief and to the point. We'd like to now invite for our special guests to take a group photo, if that's okay. They're going to be ushered out. Shingai, if you can just wave to me so that they can see you. They're going to exit stage, from the stage there. Thank you very much, Right Honourable. Thank you for joining us. Thank you. Right, so if we could ask for all our guests to stay in the room, because we're going to get into our next session, which will be reflections from African health ministers. So we invite you to stay, and they're going to be on the stage, and it's going to be a combination of health ministers from across the continent, alongside Africa CDC Acting Director, Dr. Ahmed Omar, who's going to come back. So they're going to set up. So please don't go anywhere. The session is continuous. You may stretch your legs, obviously, we can't stop you, but they will be, we'll really be continuing with the session in the next 3 to 5 minutes. So please do stay put, stay seated, and I'd like to now hand over to the moderator for the next session. And that's it from me. It's been a pleasure being here with you this morning. Thank you.
Ladies and gentlemen, we kindly ask you to please take your seats.
Ladies and gentlemen, we are now ready to begin our ministerial dialogue. And I know this kind of content is so high level and important for all of you. So please kindly take your seats so we can resume our program for the day. Thank you, ladies and gentlemen. Please, may you take your seats. Thank you very much. We weren't supposed to leave at all. It was a quick photo and escorting the Right Honorable Prime Minister out, and we continue now with our program. So please kindly take your seats so we carry on. Thank you. Thank you, ladies and gentlemen. Again, welcome back. Now we would like to continue with our program where I'm going to call back onto the stage Dr. Ahmed Omar. When he was speaking earlier, he made reference to a special award that they're going to give out today, and now is that time. So please help me welcome him warmly back onto the stage, Dr. Ahmed Omar. Thank you. You want this one? No problem.
Thank you. Thank you very much, MC. And I would like to do two things today. One is to delay your, I think there was tea, I want to delay it. This is one thing. And then second is I want to share some good news. Two pieces of good news, in fact. The first is at Africa CDC, we believe very strongly in leadership in public health. We believe so strongly in leadership in public health that we have several different programs for leadership in public health. The one that is running currently is called the Kofi Annan Global Public Health Leadership. We have the second cohort that is in session, and we have just made an announcement for a third cohort. So please visit our website. Those of you who aspire to be better public health leaders, do apply. And yes, it's only available for Africans for now. We'll open it up to the rest of the world in a few years. The second leadership program that we have launched and are just about to kick off is the Ministerial Executive Leadership Program. We know how busy our ministers are. We know how stretched they are with outbreaks and insufficient resources, a little bit of politics sometimes. And we would like to strengthen their ability to be not just heard, but to lead public health globally. So in February of this year, in the sidelines of the Africa Union Summit of Heads of State and Government, we are going to have the first session. And our honorable ministers, we are reaching out to your teams so that we see those ministers from the continent who are interested in being part of that first group. So we really encourage all our ministers of health on the continent to be part of that Ministerial Executive Leadership Program. Today, though, we would like to recognize the work that our frontline workers do. All of them, from the health professionals to the drivers, to the engineers, everybody, the village health teams, everyone who is involved in frontline health work, we would like to recognize them. And that is why we decided that every year we are going to recognize some frontline health workers through the Africa CDC DRASA Award Continental Award for Emergency Health Workers. This award is named after Dr. Ameo Stella Adadevo, who was a Nigerian physician, and in 2014, during the height of that very devastating outbreak of Ebola in West Africa, she managed to secure the first patient in Nigeria. In the process, she got infected and she died from that particular infection of Ebola. Succumbing to the disease, in her words, she said it was for the greater public good. There is no greater sacrifice than giving your life knowingly so that you can be able to protect the rest of the 200 million plus Nigerians, the rest of the 1.5 billion Africans. Because if Ebola had spread in Nigeria, it would have been a totally different picture from what we know now. So we owe a lot to Dr. Ameo Stella Adadevo. And today, we would like to do something special for her. It is brief, it is significant, and I ask you to carry this spirit forward, not as a frontline health worker only, because you all are frontline health workers one way or the other, but also as someone who appreciates good work when it has been done, and we clap for those who have done good work until it is our turn to be recognized. So today, I would like to call on stage Niniola Williams and Bankole Cardoso. Bankole Cardoso is the chairman of the DRASA Health Trust, and Niniola Williams is the managing director of the DRASA Health Trust. The DRASA Health Trust was established in recognition of Dr. Ameo's sacrifice, and we at Africa CDC have decided to name this Continental Award for Emergency Health Workers after her in recognition of that sacrifice. So, in recognition of that, every year we are going to be opening a call for nominations. And the first call will go out in 2023. But the inaugural award for 2022, we have decided to honor Dr. Ameo by giving her the inaugural award posthumously for her sacrifice, for her work, for her efforts of protecting us for the greater public good. Bankole Niniola, please join me on stage. So we start with this first. And I'll start by where I come from. We don't give people things with their left hands. I'll start by our token of recognition for the inaugural award of the Africa CDC DRASA Continental Award for Frontline Health Workers. The inaugural award, we are granting that to Dr. Ameo Stella Adadeve posthumously for the greater public good. On top of that, because we are African, no, don't look fast, because they don't know, because we are African, and because what we do is natural, it is passionate, it is real, these are the kind of things we do. So I would like our colleagues, friends from elsewhere in the world, next time you have an award, please talk to us.
You want to sign it? No? Okay.
And now you can see what so thank you for that, for giving us your ears for that very short award ceremony, and I'll hand it back over to the MC. Thank you very much.
Thank you very much, Dr. Ahmed Omar, and a very big congratulations to our award winner. It's well deserved, and I hope that you are highly honored. So thank you for that. Where I come from, you also don't receive or give anything with your left hand, so it's definitely probably an African thing in many ways. Ladies and gentlemen, I'd now like to hand over to the next moderator, who's going to take you through the reflections on Africa, where, as I mentioned earlier, the stage will now be taken over by our honorable ministers who are here present today, and they're going to lead you in some dialogue around what's going on the continent. So please help me now welcome our next moderator, and over to them, and please enjoy the rest of the day, enjoy tomorrow, and I'll see you again on Thursday. Thank you.
Good afternoon, distinguished participants, honorable ministers. I think we are well beyond time, and we are standing between you and your land. We would like to welcome you to this ministerial conversation. Now that we have been welcomed, made easy and comfortable in beautiful Kigali, we will invite honorable ministers from the region to come and share with us some of their reflections on how they have dealt with COVID-19 and how they are moving forward. So, without further ado, I would like to invite to the stage His Excellency Dr. Ivan Butera, Minister of State for Rwanda. My name is Magda Robalo. I'm former Minister of Health from Guinea-Bissau, and I'm now the President of the Institute for Global Health and Development. Welcome, Honorable Minister. His Excellency Professor Ait Taleb Khalid, Minister of Health of Morocco. Her Excellency Yolanda Owel Jeng Juash, Minister of Health from South Sudan. His Excellency Dereje Duguma, State Minister of Health from Ethiopia. I would like also to invite Dr. Hammer Kandil, Chief of Preventive Sector from Egypt, Dr. Eduardo Samugudo, Deputy Director General from the National Public Health Institute from Mozambique, and our very own Dr. Hamed Oguel Huma, Acting Director, Africa CDC. Welcome to this ministerial conversation on how, in your respective countries, you have dealt with the shock that was COVID-19 pandemic on the continent, where everyone had predicted that Africa would have been swamped, probably disappear with the number of deaths and cases that COVID would bring to the continent. Fortunately enough, the predicted numbers didn't come to happen, and we have seen a resilient Africa that stood the shock of COVID, despite the fact that also we had negative impacts in many sectors of our lives and on our economies. So I would like to start with you, and this question is going to move around. I would like to call on your ability to synthesize, because we have very short time for this conversation, and give us an example of how your respective country was able to deal with this shock, and how are you recovering and moving forward in your respective countries. 3 minutes if you can. I know ministers can speak for a long time on what they are doing in their countries, but I would like to kindly request you to focus on this point and share with the audience what you're doing in your respective country, what you have done and what you're doing. Please, let's start with Honorable Minister from Rwanda, our host. Thank you.
Thank you very much. I think the management of COVID-19 in Rwanda has been, if I can summarize it, dynamic, based on evidence and involving the entire community. So from the get-go, even before COVID reached in Rwanda, we established a national joint task force that involved many actors. So it was an interdisciplinary task force. So you had people from the health sector, logistics, local government, community, scientists. So this task force was meeting on a daily basis to try and understand what would come. When COVID reaches in Rwanda, what are you going to do in terms of preparation? So with that, we developed the preparedness and response plan that came into force even before the first case arrived. So now, we diagnosed the first case of COVID-19 in Rwanda on March 14th, 2020, in an inbound traveler. And from that time, we developed quickly clinical guidelines, testing guidelines, and we started seeing, okay, COVID is going to get in the country, but how don't you disrupt essential health services as well? So what we did is that we established treatment centers that were not mixed with the hospitals, and with that, we ensured continuation of service. And additionally, we put in place some innovations to combat misinformation. So for example, we had drones especially during the lockdowns, there was not movement of people. So we had drones going throughout the country, spreading information, okay, COVID is this type of disease, it gets spread like this, you can prevent it this way. So this quite helped in terms of spreading the information to the communities. Another thing we did, if I can take an example for innovation, is for testing. We were at a low prevalence area in Rwanda at the beginning, but we didn't have enough testing kits, just as many African countries. Alongside our colleagues at Africa Institute of Mathematical Science, we developed an algorithm where you can pull samples together, and with that, with limited testing kits, you can test. And this was published actually in a scientific review, Nature. And with that, we spread the information, and with less resources, we could do more testing. And with more testing, you kind of have an idea of how the pandemic is in the country. And with that, we knew how to manage the cases. Quickly, we saw that actually the morbidity of COVID was not that much in Africa. So we quickly shift from the centers that I talked about earlier, treatment center, to a home-based care system where people, with a follow-up with the Rwanda Biomedical Center, could call and see how you're doing, and people were still at home, so that you don't strain the health system and you reduce. So these are a few of the things we did, and some of the things we can talk about later. When vaccination came, maybe we can talk about it later. The existing health system in Rwanda was receptive so that as soon as the first vaccine landed in Rwanda, we had the capacity within 24 hours, regardless of where you are in the country, you could receive your vaccine. And this was built upon years of strengthening public health system, which I think is a lesson we learned from HIV, TB, malaria, for one disease to be an opportunity to horizontally strengthen your public health system. And we are doing this with COVID as well. And I think these are some of the lessons that we can take from Rwanda. Thank you.
Thank you very much. I suspect you didn't have many interruptions or even disruptions on provision of essential services because of the way you have described your approach to tackling COVID cases. We move now to Morocco, our only African team standing. The team that's going to take the cup back home, right? Honorable Minister, we are going to discuss tactics here, but tactics within the health system. How did you deal with COVID-19 and how were you recovering? We can see that you are strong enough.
D'abord, merci d'être reçu ici à Kigali. Je me sens chez moi. C'est la première fois. Alors, comment le Maroc a pu vivre quand même la période de Covid sous le leadership de Sa Majesté le Roi, que Dieu le glorifie. On avait vécu la Covid selon ces trois différentes phases. Personne ne peut prétendre au jour d'aujourd'hui qu'il y a quand même une recette qui est adaptée, bien sûr, à tout un pays pour faire face, bien sûr, à la Covid. Chaque pays, bien sûr, a pu s'adapter en fonction de ses moyens et en fonction de son contexte. C'est la raison pour laquelle, moi, je résume que la gestion de la Covid, elle est basée essentiellement sur l'anticipation et la gestion proactive. C'est ce que nous avions fait au Maroc. Dès l'apparition des premiers cas au monde, on s'est préparé, bien sûr, par la création d'un comité de pilotage. Un comité de pilotage qui dit comité représentatif polyvalent, avec des membres qui représentent le service sanitaire, la sécurité, l'économique, pour éventuellement accompagner, bien sûr, cette crise. Et de l'autre côté, au niveau du système de santé, il y a les comités de vigilance, mais aussi il y a un comité technique scientifique qui permet d'accompagner, bien sûr, le grand fléau de la Covid, c'est la désinformation. C'est ce qui a représenté éventuellement au niveau mondial la psychose au niveau des populations. Alors pendant la première période, et c'était la période où il y avait le virus, le variant classique, le alpha, et le classique et l'alpha, tout le monde, bien sûr, avait peur comment, bien sûr, gérer la situation. Au Maroc, on s'est rabattu sur le confinement. On avait des insuffisances, peu de gens, il y a une pénurie de ressources humaines. On avait seulement 684 lits dédiés à la réanimation. Et pendant cette période de confinement, ça nous a permis d'augmenter notre résilience. Imaginez que nous avons augmenté notre capacité d'hospitalisation en réanimation de 684 lits à 5260 lits. Et pendant cette période où les frontières aériennes étaient fermées, il y avait un travail, bien sûr, de rapprochement diplomatique pour essayer d'avoir, bien sûr, le maximum de matériel biomédical. Et que vous savez, ma foi, vous savez très bien comment c'était difficile un petit peu. Il y avait un rush mondial sur la répartition des respirateurs. Et aussi, il y avait la question, bien sûr, du masque. Pendant cette période aussi, nous avons converti notre industrie et nous avons commencé à fabriquer les masques au Maroc directement. Bien sûr, l'approvisionnement aussi des kits. Et c'est ce qui nous a pris, bien sûr, la Covid. Nous avons pu quand même commencer à fabriquer tout ce qui est des tests de Covid au niveau d'un laboratoire marocain, les masques, et par la suite, on a commencé à réfléchir d'emblée sur la vaccination parce qu'on avait compris que l'aboutissement était bien sûr la vaccination. On le voyait venir. Et d'ores et déjà, on avait commencé les contacts avec les producteurs de vaccins et on était parmi les pays qui avaient commencé le premier essai vaccinal. On était bien sûr en collaboration avec le laboratoire chinois, c'est le vaccin Sinopharm. On avait cru au vaccin entier, inactivé, et on a été parmi les premiers pays à être approvisionnés en vaccin. Et bien sûr, par la suite est venue la deuxième vague importante où le virus, sous sa forme variante du bêta, elle était un peu mortelle par rapport au classique. Et bien sûr, éventuellement, le pays commençait à avoir la maîtrise sur l'épidémiologie et on commençait à avoir quand même un peu d'allègement des mesures de restriction. Mais pendant cette vague-là, on a connu une autre difficulté. C'était la difficulté d'approvisionnement en oxygène. ce que le monde aussi avait connu comme problématique. Et pendant cette période, qu'est-ce qu'on a fait comme solution? On a doté tous les hôpitaux du Maroc en générateurs d'oxygène. Et on avait bien sûr le double usage, l'approvisionnement en oxygène liquide et en même temps en générateur d'oxygène qui suppléait un petit peu, bien sûr, cette difficulté. On n'a pas connu de rupture d'oxygène. Et puis par la suite, il y a les autres vagues qui sont venues et qui étaient accompagnées par la campagne de vaccination. Et pendant cette campagne de vaccination, bien sûr, il y a un travail d'information qui a été, bien sûr, et de logistique important parce qu'il faudrait utiliser plusieurs vaccins, la chaîne de froid. Je m'excuse si je suis un peu lent, je pense que je dois m'arrêter. Je m'arrête. Ben voilà, je m'arrête. Je ne termine pas l'expérience marocaine, même si demain le Maroc va jouer, mais je termine pas.
Il faut résumer, il faut résumer.
Alors la dernière étape, c'est qu'on a joué sur l'immunité collective. Bien sûr, il y avait quand même une vaccination en masse, qui était bien sûr en période très courte, qui a permis de diminuer, bien sûr, les formes graves de Covid. Et on est aujourd'hui conscient que la vaccination a pu quand même améliorer la gestion du Covid aujourd'hui. Merci.
Merci. Merci beaucoup, Monsieur le ministre. Et, désolé, on n'a pas beaucoup de temps, mais on voit que le Maroc avait beaucoup de capacités d'innovation et de production locale de matériel, équipement et même a pu éteindre la distribution d'oxygène et vacciner une grande partie de la population. Let's go now to South Sudan. Honorable Minister Yolanda Juak, please share with us how did South Sudan live through COVID-19 and how are you recovering?
Thank you so much. I'm glad to be here today to join my colleagues and to join the continent in regard to the lesson learned during COVID and the past pandemic. South Sudan, as many of you know, we emerged from a series of wars. We were in 21-year conflict that ended in 2005, and then we gained our independence in 2011. When we gained our independence, South Sudan inherited a very weak health system from the then Sudan. Our health infrastructures, our health system, our public health care was in shambles by the time pandemic hit. We were already battling many outbreaks like cholera, meningitis, most preventable diseases that we're battling with. So by the time COVID-19 hit, we did not have a proper health infrastructure in place. So when the world turned their back again at South Sudan, we have to dig deep inside, and we have to take a driving seat. The government of South Sudan formed a COVID-19 task force, whereby the president, the vice president, the ministers were the one at the front line battling COVID-19. How are we battling COVID-19? Through advocacy. We had to go to the public media to take our vaccination because we had got a very bad stigma around that time in regard to COVID-19 vaccination, in regard to, is COVID-19 really real or is it just a myth, and all this kind of thing. So South Sudan government took leadership role. We took a leadership role whereby mechanisms were put in place to coordinate international partners, local NGOs, private investors, and we had rules and regulations to guide the delivery of health services. COVID-19 came at the point whereby South Sudan was already in the face of another second civil war. We were in the process of implementing peace agreement. And with this peace agreement, the phases were slowed down. And slowing down of those phases impacted quality health services delivery and access to 90% of the people. The 90% of our population in South Sudan is not in urban centers, like the way it is in KIGALI and the rest of Africa. The dense population, it is in rural areas. So the main lesson we learned during COVID-19 is localization and strengthening of healthcare system at the community level through what we call Boma Health Initiative. So as a country and as a continent, you have to empower your root level sort of strategy whereby it is going to be empowered when another pandemic comes. Currently, South Sudan is in readiness mode for outbreak in the neighboring country, Kampala. I am sitting here as the chair of East African Ebola Task Force, and that one has given us an opportunity to at least repair infrastructures in my country. But the investment, it is still highly needed. The domestic investment is still very poor in health sector. International investment is still very poor in the health sector, as well as private investment. So I urge all of us African to put more priority in healthcare, to put more priority in making sure we realize the new public health order that has been initiated. I will stop there, Your Excellency. Thank you.
I really appreciate you touching upon on the issue of domestic resource mobilization and investment in the health sector. We are moving now to Egypt. Egypt was the first country to declare a case of COVID-19 on the continent. If I'm not mistaken, this was on the 14th of February of 2020. So Dr. Kanjil, please tell us how you did manage your COVID-19 pandemic and how are you recovering from it?
Thank you, Excellency, Honorable Minister, ladies and gentlemen. It is my pleasure to be here today on the second International Conference on Public Health in Africa. Since the beginning of the COVID pandemic, Egypt has recognized the necessity to attain health security for a country with a population of over 100 million, such as Egypt. It is the third most populous country on the African continent. Egypt has moved in two parallel routes to accomplish this objective. First, we work hard to increase the classification of Egyptian Drug Authority, which is the official regulatory body for medicine, vaccine, and medical supplies in Egypt. In February 2022, we obtained mandatory level 3 in vaccine regulation from the World Health Organization, allowing Egypt to advance in the production of vaccine and to ensure their efficiency and quality from a regulatory standpoint. Second, the national effort to localize the production of COVID-19 vaccine through successful partnership between the well-known Chinese company Sinovac and well-known Egyptian company Vaxera, which began in April 2021, have so far resulted in the production of nearly about 15 million doses of COVID vaccine, which has led the Egypt self-sufficiently and the gifting of vaccine to friendly nation. In addition, in February 2022, the WHO Director General nominated Egypt as one of 6 African countries to obtain the messenger RNA technology for future manufacturing of vaccines and other medicine through one of the large Egyptian company named Biogeneric Pharma. These coordination steps have resulted in transition to the more critical stage, which is the ability to manufacture the vaccines other than COVID vaccine, as the Vaxera company have signed a long-term partnership agreement with the Serum Institute of India to manufacture 8 types of compulsory vaccine in Egypt, as well as pneumococcal vaccine, and preliminary memorandum of understanding with Pfizer to manufacturing the same vaccine also. During the pandemic, Egyptian pharmaceutical manufacturers produced a collection of anti-coronavirus medication, including remdesivir and flavivir and molnupiravir, as well as all antibiotic, antifungal, and respiratory treatments.
Dr. Kandil?
Okay.
Sorry.
Finally, I thank and acknowledge the effort of African CDC for its distinguished initiative that have contributed to alleviating the impacts of pandemic on the many of African countries by providing platform for purchase of medicine and the medical supply as well as vaccine at the difficult time of for this continent. And I would also like to reiterate the Egypt commitment to support the Africa country with all its manufacture capability to meet the goal of African Union. Thank you.
Thank you. Sharing with us what Egypt did, particularly in the area of production of vaccines and manufacturing, the technologies, therapeutics that were required for combating COVID-19. Dr. Eduardo Samogudo, no mesmo sentido, gostaríamos que partilhasse conosco as experiências únicas de Moçambique. What was unique in Mozambique regarding COVID-19 pandemic?
I'm happy that you speak Portuguese. Not always that we have a moderator that speaks in our language. Mozambique is one of the Portuguese-speaking countries, but I will speak in English for the audience. So thank you. So I am honored to join this excellent panel, and then also honored to be here on behalf of the Minister of Health in Mozambique. So I would like to convey the greeting of Minister of Health in Mozambique. I will not repeat. I think what my colleague has said, I think is the same across the countries. But I would like to, despite this repetition, to emphasize the high-level commitment. So we have seen a high-level commitment from the top leadership in the country, from the president of the country. Our president he became a public health expert during the pandemic. So that was amazing. It was nice to see how he's, few months after the beginning of the pandemic, he was able to speak, to talk about some of the concepts that for ordinary people, they are quite challenging. So I think that has been one of the key elements. The evidence issue, the evidence-based response was key. So the president, right in the beginning, they listened to the scientists. So he assembled, right in the beginning, he appointed a technical scientific committee to advise him. And then I would say that I am very happy to say that, and honored and proud to say that I think 90%, many of the times when we advise, decisions is a combination of factors, it's a multifactorial. So you as a politician, you have to combine science, social aspect, economics, and then other issues, so to make your decisions. So the fact that I am happy to say that 90% of recommendations that were issued by this technical scientific committee were appointed by the president was endorsed by the president on his decisions on the different waves. So that has been really an achievement for the continent. I think one of the, listening to other colleagues, so that it's not only Mozambique, that was across the continent. So I think we have a great momentum for public health in the continent. So we should not lose that momentum in which our leaders, our president, now they understand the importance of public health. They understand the importance of science. They understand the importance of evidence. So I think those has been the key roles. And then the other components are the same that my colleague from other councils expressed. So I'll try to save you time. Thank you.
Thank you very much for reminding us that this is a special moment in public health in Africa, and we shouldn't waste this opportunity for trying to build resilient systems for health. We'll come back to that. Dr. Huma, I can imagine how difficult it was for Africa CDC on the face of spreading cases across the continent, and of course you couldn't be everywhere. What did you do in order to strengthen support to the countries in an efficient and effective way? What was the key strategy Africa CDC deployed for giving support to member states?
Thank you, Magda, and good afternoon. So I'll stick to three because there are quite a number of things that we did, but three stand up. One is the involvement of our leaders on the continent. Between March and December, they met at least 12 times. It was virtual, but for heads of states to leave their state duties to meet and discuss COVID and how to respond, this was big, very unprecedented. So that leadership opened the door for the ability for us as Africa CDC and the Africa Union to gain the confidence of guiding the continent's response, because there was very strong commitment and political leadership. Second is sticking to science and evidence. Right from the beginning, and you recall how at the beginning of the pandemic there were so many different ideas of what works and what doesn't work. And there was a lot of pressure on the continent for certain approaches that others thought that would be able to work. We stuck to the evidence, we stuck to the science, and in this way provided very key guidance, very key leadership to our member states to be able to follow that. We issued dozens of guidelines, dozens of technical documents that our member states then used to do the local country level implementation. Third is the sheer strength of partnerships. This was new for everybody, and despite the fact that it was new, there are those who had slightly better access to certain tools more than we did on the continent. But we galvanized what we had on the continent first. For example, right at the beginning of the pandemic, because of the low capacity in terms of human capacity, in terms of expertise, there are countries that didn't have a very strong public health expertise, and we picked experts from one country to support another country to build that capacity. So the partnership we started on the continent amongst our member states, and then we brought on board the non-state actors. It has been a fantastic journey of building functional and very productive partnerships across the time. And finally, not fourth, but finally, a part of partnership that has really worked is the member states participated fully in Africa CDC's coordination efforts. And whatever was being advised, whatever was being proposed, the member states took that up and implemented it very effectively, and our numbers have remained way, way below all the predictions that had been made at the beginning of the pandemic. So we have quite a lot to share with the rest of the world, how to respond to a fast-moving disease outbreak. Thank you.
Thank you. And this is where the new public health order was born out of realizing that we needed to pull our forces together and move forward. Honorable Minister, I'm coming back to you. Listening to the comment from Mozambique about the momentum that we are going through on the continent for public health, knowing that domestic financing investment in our health systems is still not to the level that is required, knowing that we still don't have the workforce that is needed, not only at the grassroots, but even in terms of qualified people in numbers that are required, diverse as required for driving the innovation that Egypt and Morocco were talking about. What is Rwanda doing to sustain investments, financial investments in the health sector so that we reduce reliance and dependence on foreign investment and we can build and work with our own legs?
Right. Rwanda believes that health is not a luxury. Health is a universal right. And if you look at the numbers, more than 95% of Rwandans have a health coverage to primarily prevent from catastrophic health expenditure. So from the get-go, as a philosophy, that's what Rwanda believes in. Secondly, we understand that investment in health, you see a return. So we have evidence that for every dollar that you invest in health, you have at least a return on investment of $4. So even with that perspective, and especially COVID has showed us again, that when you have a disruption in health, the downstream effects goes beyond health. You also disrupt economy and everything. So Rwanda is among countries that are part of the Abuja Declaration. We spend 15% of our budget into health. And this has helped set the foundation for the health system in Rwanda. So, but of course, the cost of health is increasing. We try to find innovative ways, especially in being efficient. So when you build a system, over time, you iterate it, and over time you find efficiencies. You close areas of inefficiencies, and you find ways to utilize better the resources that you have. And that's how I talked about earlier, the way we were able to optimize our testing resources based on the science innovation. So again, another thing that we think is that partnerships are very important. We try to work with different partners, especially our private sector here. Because they understand that we all have to be healthy so that our country grows, so that people have the purchasing power, so they have a role to play in it. So we have a pool where, for the health insurance part, the private health insurances also invest a certain amount of money to cover for the people. So these are some of a few things that we do. But going on, we saw again that we still had some lacks in the system, especially for vaccine and medicine production. Again, you start by building the foundation. So we're happy to say that, for example, the African Medicine Agency's headquarters is based in Rwanda. It's going to be a good regulatory agencies for the next step that we're going in. We're going to soon be producing vaccines with the mRNA-based technology in collaboration with BioNTech, and not only for COVID, but for other technologies such as HIV, TB, malaria. But these are always investments that are aimed to have a healthy, productive population, and this is a work in progress. But again, to close, I say that we don't take health lightly, but it's very on top, and the leadership led by His Excellency President of the Republic himself, President Paul Kagame, believes and drives us in this way, where investments in health is a prerequisite, if you will, for economic development. Thank you.
Congratulations on the 15% of the national budgets going to health, and the vision that health is not a luxury. Going back to the Minister of Morocco, we are seeing ambition across Africa to be able to, the right ambition, to be able to produce, manufacture vaccines, therapeutics, diagnostics, so that we reduce or even eliminate dependency on importation. Africa produces a very tiny fraction of what it consumes in terms of health products. But we need to be mindful of the market forces within the continent. If every country establishes its own production, we may not be able to sell to other countries. What are your perspectives about this? How should we coordinate ourselves so that we make sure that we produce what we need and we can sell so that our manufacturing can also continue to move.
Merci pour cette question qui est très pertinente aujourd'hui et qui se pose de manière accrue. Et avec acuité, surtout qu'aujourd'hui, on est en train de parler de la souveraineté continentale. Et quand on parle de la souveraineté continentale, c'est la première leçon à tirer aujourd'hui, bien sûr, de la Covid. Qui dit souveraineté dit aussi sécurité sanitaire. Et donc, je pense que c'est la prise de conscience de tout un pays aujourd'hui qui a voulu ce que nous avions vécu dans la répartition inéquitable des vaccins à l'échelle mondiale et planétaire, que ça ne se reproduira plus au niveau continental. Sa Majesté le Roi avait donné bien sûr ses instructions pour qu'il y ait quand même une production et un manufacturing in situ. Certes, le marché, il est petit, mais si nous travaillons en réseau, si chaque pays africain aujourd'hui, il détient quand même un programme d'immunisation. Et je pense qu'on doit travailler bien sûr en réseau, en mettre en musique quels sont nos besoins et que l'on puisse éventuellement converger vers une production qui est africaine et non pas tout un chacun. C'est transnational ce qu'il faudrait faire. Merci beaucoup.
Merci beaucoup. And I will call upon Dr. Ouma to just comment on this transnational networked coordination of manufacturing within the continent so that we preserve our markets and we remain efficient and productive.
Yeah, no, thank you very much. As you were speaking, I am going into what we've been doing in as far as this coordination of manufacturing is concerned. So let me pick out two things here. One is the fact that we manufacture only 1% of the human vaccines that we need on the continent. 99% comes from outside, and this is without COVID. If we put in COVID, the permutations become very different, worse. Now, what we've done as Africa CDC is under our Partnership for African Vaccines Manufacturing, we've mapped out which are the types of vaccines that we need on the continent as a priority. We don't want to do everything. And the reason for doing that is so that when countries with the ambition to put in place the enterprise of vaccines manufacturing can be able to do it in a way that we respect the continent's market access. You don't want many countries manufacturing one type of vaccine. So this is one thing that we are doing by coordinating what type of vaccines we need. Second is what each country then will be able to do. Because quite a number of countries have come through and have committed to putting in place vaccines manufacturing infrastructure. So we are working with all of them to ensure that we are picking out all types of vaccines and they're being manufactured across board in a way that does not disrupt the market. Because we want that when those vaccines have been manufactured, we find a market for them in Africa first before we compete with the rest of the world. So we are doing these two things, identifying what needs to be manufactured, and then in the manufacturing process, countries are manufacturing in an organized way so that we don't get flooding in one place and yet we don't have other areas being covered. So two very important things that we are doing in that coordination effort.
To you with a final question on how we harnessing partnerships in order to make this work. Now, Minister Yolanda from South Sudan, South Sudan being the youngest country on the continent, how are you dealing with the challenge of the workforce to deliver health services and prepare for the next pandemic? I think this is one of the issues that keep health ministers up at night.
Thank you so much. As you have mentioned there, South Sudan is the new kid in the neighborhood in Africa. And as I mentioned earlier on, we inherited, as I mentioned, a very weak health system. But the leaders in my country tried so much to put in some measures to make sure we have got a workforce that is going to enhance the health system and have a sustainability and retention package. That is not a very easy thing to achieve when we have got a shortage of healthcare personnel, when we have got brain drain, when you are dealing with multiple factors that come with the post-conflict sort of situation in a health crisis. Workforce in Africa, we leave it to who it may concern, but it should be an area whereby we put in more priority and invest in it. South Sudan at the moment is exactly embarking on what we call mid-level healthcare professionals, whereby, as I mentioned earlier on, majority of our population is at the rural setting. According to the 2011 census that was done, or survey, there's one doctor to 65,000 people, and there's about 39 population to one midwife. That shows that like our healthcare personnel is really very low, and there's a very high need. What do we do to actually make sure that like the work retention is there? What do we do to make sure that like the work care, the healthcare personnel are actually maintained and do not run to Rwanda, or they don't run to Uganda, or these other countries that are highly developed in the region? Is to implement faithfully the Abuja Declaration. The Abuja Declarations state that 15% of the national budget has to be allocated to healthcare. At the moment, South Sudan is dwindling between 2% and 7%. That shows that like we are not where we are supposed to be. That leaves us with a very struggling healthcare system, which we actually need to empower. There are more dialogues at the moment at the government level, in the parliament, in the executive level, to make sure that like we reach to where we are in terms of healthcare personnel.
Thank you. Thank you very much. I'll go to Mozambique now. Mozambique is prone to cyclones and climate change-related events which disrupt the health systems, and we have seen health centers being washed away, and many challenges combined with infectious disease outbreaks, etc. How does Mozambique integrate the One Health concept into your response to the challenges that affect the health sector?
Thank you. So I am happy that you asked a question about cyclones. So I would like to remind that Mozambique, based on the 2018 climate index that ranked the countries according to the vulnerability to extreme climate events, Mozambique has been ranked in the top 5 countries in the world that are more hit and vulnerable to extreme climate events. So you mentioned, I think you recall of Idai cyclone, that there are 600 people that died, and then more than 1 million of people they were internally displaced. So Mozambique now, we went from one cyclone per decade in 80s to 3 cyclones per year now in Mozambique. So that obviously is because of the heating of the Indian Ocean, and that principle increased the risk and the frequency of the extreme climate events. So it's important to remind that the responsibility and role due for health is not only for the Ministry of Health. This should be for the entire society. So the concept of all society, it's important. So One Health means that we should look to health in a more broad approach. So we should look to health from the animal component, from the climate component, from the infrastructure, from the environment, and then many other sectors in the country. So because it's common that all the burden is given to the Ministry of Health. So it's the Ministry of Health that should educate people that cyclone is coming. It's Ministry of Health that should, when cyclone is coming, that should provide the chlorine to disinfect the water to avoid cholera. It's the Ministry of Health that should also provide all the services that are needed to prevent and respond to the cyclones. But we forget that the role of the Ministry of Health is to provide care. So if we don't engage all the ministries within the effort and fight and then to ensure, against the disease, and ensure that we have a continent that we can provide better health to the continent, we will miss that. Because the Ministry of Health will never, ever be able to get the full budget to provide those all services. So in Mozambique, what we have been doing, Mozambique now, we have approved, the Council of Ministers just recently, 2 weeks ago, approved the first National Action Plan for Health Security. It's an interministerial plan. National Health Security Council has been assigned. This National Health Security Council is being chaired by the Prime Minister. The Vice Chair is the Minister of Health. And then one of the main roles of that is to build the concept that health security is a multi-sectorial responsibility. It's not only unique responsibility of Minister of Health.
Thank you. A multi-sectoral approach that needs to be taken for dealing with health hazards and moving forward. Coming to Egypt now, communication, misinformation, infodemic was another pandemic on its own. How did Egypt deal with that?
I think communication, it is the main thing especially in the infectious disease and during the epidemic and pandemic. Egypt, in the communication, first we have awareness campaign, okay, starting from the rural level to the district level, and then the governorate, and then central. Increase the awareness through, we have what's called the program called Ra'idat Rifiyat. It is a rural area community health worker. It is the link between the community and the family and their health unit to transfer their needs of the community to the health service, and also transfer the message from the health units and district to the community. This is one thing. Another, it is we have prepared a lot of the training for the healthcare worker to communicate with the different family and different members. Also, we have also a campaign, media campaign, and in the TV and radio campaign for the increased awareness and to build the trust. This is very important between the Ministry of Health and the government and the community. This is very important, and to announce and regular announcement of the any event of public health.
Thank you. So this was the time that we had available. We will still 5 minutes from the conference just to give you the opportunity to give us one take-home message. I will start with my sister from South Sudan. Very brief, very catchy. What's your take-home message for the public health, young people, the women, the experts, the senior people listening to you now?
Thank you so much. I'll just make it brief. I have got maybe 3 take-home messages. One thing is the ownership of your own health. Your health is your security. Health is your sovereignty, and you don't leave it to who it may concern. Number 2 is the investment in yourself, the investment in your country, and take a health a priority. Number 3, it is the involvement of everybody. Nobody is going to tackle the current pandemic and the future pandemic by themselves. We live as a collective society, and we should own that collectiveness of Africa. Thank you.
Dr. Huma, your take-home message, please.
Full implementation of the new public health order.
Wonderful. Let's now move to Mozambique, followed by Egypt.
Thank you. So I think there is a statement, African statement, that says, I've seen this indeed in the Johannesburg airport when you go to boarding. I think you have, many of you have seen, but that is an African one. So we have to take note of that and make sure that we endorse that. That statement says, if we want to go fast, we go alone. If we want to go far, we should go together. I think it's time that we embrace the new public health order and we go together toward a better Africa. Thank you.
Thank you. Egypt?
I heard in the morning not a second international public health conference, public health movement. So I think we have a public. This is a time for all of the country, all over the continent, to invest in the public health and to get it in the top priority of the country, and the preventive activity and sustainable investment in this very important issue.
Thank you. Morocco, before I come to our host, we'll all come to Morocco to celebrate the cup.
Alors si j'ai un message à passer aujourd'hui, c'est pour dire que le destin de l'Afrique, c'est entre les mains des Africains. Travaillons tous pour la souveraineté africaine. Merci.
Merci beaucoup. Finally, last but not least, Dr. Butera.
Yes, thank you. I think we're moving towards inclusive, progressive, resilient, agile health systems for the common well-being of the African population and therefore the development at large.
Thank you. Thank you very much. Ladies and gentlemen, this is the end of our ministerial panel. Time was short, but I think there was a lot of wisdom from our ministers and senior officials, from ownership, go together so that we can go further, new public health order, make it a movement, innovation and leadership. You have heard what our leaders on the continent are saying, and I'm sure those within the room and those listening to us online would agree that the destiny of the continent is on our hands. It's up to us to define what we want from our present and particularly the future of the next generation. Thank you very much for being there with us. I would like to thank the panelists for really bearing with me and enjoy the rest of the conference. It has started, and let's go with it. Thank you very much.
Thank you. Thank you, Dr. Magda, our fantastic moderator. We'll now break for lunch, a very hearty lunch, and we'll be back in this room at 2:30 with track 6. Thank you.